My name is Megan, and I live in Milwaukee, Wisconsin. I work in marketing, and in my spare time, I have just about every hobby I can pack in. It's just staying active and having fun with my friends. I was actually on spring break with my best friend in Florida, and we decided to go for a run on the beach. And all of a sudden, out of nowhere, I just had to go to the bathroom really, really bad, and found a bathroom. And I was like, all right, that was weird, and kept running, and it happened again. And I was like, well, that's kind of weird. And I was like, oh, whatever. It's just a bug. It's just something. I'll get over it. And I never did. I was diagnosed officially just months before I left for college. So it really made it difficult to sort of just be a normal college kid, especially when I couldn't eat a lot of things. So I could go to a party, and if it was something as little as the line for the bathroom is long, I'm out of there. It wouldn't be worth it to risk it. So I feel like I missed out on relationship, friendship building, and meeting people and going on adventures and road trips and what else, all of the fun parts. I have ulcerative colitis. So I remember thinking my lowest point was probably about junior year. There was a time that I was sitting in my apartment watching TV Friday night, maybe Saturday night, and I was like, how come nobody will hang out with me? How come I'm not worth missing a party or, and I was like, I just want a friend. That's all I want. Someone just sit with me and let me just kind of unload this burden for a while and just be there. So when it really sank in that this is a chronic disease, that I was going to have it for the rest of my life, it just hit me like a ton of bricks. When I was first diagnosed, I started on some pills, and they were kind of working, but not really working. And so I found a new doctor. One of the things that he said that really stuck with me is that we're going to try whatever it takes to get you into remission and get you healthy, which is my previous doctors. I didn't feel like they even had that goal. So we went through a couple different treatments, and everything kind of worked, but I'm like, I don't want it to be good enough. I want to be able to live my life the way that I want to and make the most of it. So my doctor suggested Remicade as an option, and I actually remember sort of crying in the doctor's office, and I'm like, I'm not afraid of Remicade. I'm afraid of it not working and losing this as an option. So it was 3 days after my first infusion, and I had gotten a good night's sleep because I didn't have to wake up in the middle of the night sprinting to the bathroom. And I wasn't totally symptom-free that day, but it was definitely like the first time in years, all through college, that I was like, this might work. There's definitely hope for patients to find the right treatment. I think it's important for patients to know that they can and should take care of their own health journey, whether it means firing their doctor and finding a different doctor, incorporating some different people on their team. Just keep going after it until you find something that works. It took me a really long time to be like, this is happening, like this is real remission. And just thinking back of how long it took to get there and how precious it is to have something that allows you to live your life. Never, ever, ever want to lose that. So I don't want to give up Remicade for anything. As long as it's working, I want to stay on Remicade.
Important safety information. Only your doctor can recommend a course of treatment after checking your health condition. Remicade, infliximab, can cause serious side effects such as lowering your ability to fight infections. Some patients, especially those 65 years and older, have had serious infections caused by viruses, fungi, or bacteria that have spread throughout the body, including tuberculosis, TB, and histoplasmosis. Some of these infections have been fatal. Your doctor should monitor you closely for signs and symptoms of TB during treatment with Remicade. Unusual cancers have been reported in children and teenage patients taking TNF blocker medicines. Hepatosplenic T-cell lymphoma, a rare form of fatal lymphoma, has occurred mostly in teenage or young adult males with Crohn's disease, or ulcerative colitis who were taking Remicade and azathioprine or 6-mercaptopurine. For children and adults taking TNF blockers, including Remicade, the chances of getting lymphoma or other cancers may increase. You should discuss any concerns about your health and medical care with your doctor. What should I tell my doctor before I take Remicade? You should let your doctor know if you have or ever had any of the following: tuberculosis, TB, or have been near someone who has TB. Your doctor will check you for TB with a skin test. If you have latent, inactive TB, you will begin TB treatment before you start Remicade. Lived in a region where certain fungal infections like histoplasmosis or coccidioidomycosis are common. Infections that keep coming back, have diabetes or an immune system problem, any type of cancer or a risk factor for developing cancer. For example, chronic obstructive pulmonary disease, COPD, or had phototherapy for psoriasis. Heart failure or any heart condition. Many people with heart failure should not take Remicade. Hepatitis B virus, HBV infection, or think you may be a carrier of HBV. Your doctor will test you for HBV. Nervous system disorders, like multiple sclerosis or Guillain-Barré syndrome. Also tell your doctor if you use the medicines Kineret, anakinra, Orencia, abatacept, or Actemra, tocilizumab, or other medicines called biologics used to treat the same problems as Remicade, are pregnant, plan to become pregnant, are breastfeeding, or have a baby and were using Remicade during your pregnancy. Tell your baby's doctor about your Remicade use. If your baby receives a live vaccine within 6 months after birth, your baby may develop infections with serious complications that can lead to death. Recently received or are scheduled to receive a vaccine. Adults and children taking Remicade should not receive live vaccines or treatment with a weakened bacteria, such as BCG for bladder cancer, while taking Remicade. What should I watch for and talk to my doctor about before or while taking Remicade? The following serious, sometimes fatal side effects have been reported in people taking Remicade. You should tell your doctor right away if you have any of the signs listed below. Infections like TB, blood infections, pneumonia, fever, tiredness, cough, flu, or warm, red, or painful skin or any open sores. Remicade can make you more likely to get an infection or make any infection that you have worse. Reactivation of HBV, feeling unwell, poor appetite, tiredness, fever, skin rash, and/or joint pain, lymphoma, or any other cancers in adults and children. Skin cancer, any changes in or growths on your skin. Cervical cancer. Your doctor may recommend that you be regularly screened. Some women with rheumatoid arthritis, particularly those over 60, have developed cervical cancer. Heart failure, new or worsening symptoms, such as shortness of breath, swelling of your ankles or feet, or sudden weight gain. Other heart problems within 24 hours of infusion, including heart attack, low blood flow to the heart, or abnormal heart rhythm, chest discomfort or pain, arm pain, stomach pain, shortness of breath, anxiety, lightheadedness, dizziness, fainting, sweating, nausea, vomiting, fluttering or pounding in your chest, and/or a fast or a slow heartbeat. Liver injury, jaundice, yellow skin and eyes, dark brown urine, right-sided abdominal pain, fever or severe tiredness. Blood disorders, fever that doesn't go away, bruising, bleeding, or severe paleness. Nervous system disorders, numbness, weakness, tingling, changes in your vision or seizures. Stroke within 24 hours of infusion. Numbness or weakness of the face, arm, or leg, especially on one side of the body. Sudden confusion, trouble speaking or understanding. Sudden trouble seeing in one or both eyes. Sudden trouble walking. Dizziness, loss of balance or coordination, or a sudden severe headache. Allergic reactions during or after the infusion. Hives, difficulty breathing, chest pain, high or low blood pressure, and fever or chills. Delayed allergic reactions, 3 to 12 days after infusion. Fever, rash, headache, sore throat, muscle or joint pain, swelling of the face and hands or difficulty swallowing. Lupus-like syndrome, chest discomfort or pain that does not go away. Shortness of breath, joint pain, rash on the cheeks or arms that gets worse in the sun. Psoriasis, new or worsening psoriasis such as red scaly patches or raised bumps on the skin that are filled with pus. The most common side effects of Remicade include respiratory infections that may include sinus infections and sore throat, headache, rash, coughing, and stomach pain. Please see full product information, including boxed warning and medication guide for Remicade, available at www.remicade.com, and discuss any questions you have with your doctor. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088.